Hi, I'm Chris Saballero. Thanks for joining us. You know, our job as EMS providers is to fix the patient's problem, get them the definitive care so the doctor can fix the system. Well, as we get the patient out of our ambulance and into the ER, this is a very important process to that patient care.
They'll get you situated and take care of you, find out what's going on.
One of the things I like to do as a paramedic is I like to tell the patient what they're going to experience as they get them into the ER. Remember, this could be a very stressful time for them, and giving them as much information as possible not only builds your rapport and credibility with them, but it kind of gives them an understanding of what they can expect as they go into the facility. You know, as we enter the hospital, one of the important things as we get our room assignments is to stay with the patient until we give a patient report. And this is what's really important, because if we wander off and we leave that patient, one of the things that could happen if the patient gets hurt, we still have some liability there. So stay with the patient at all times until you can give a report. One of the things I want to bring up to you is sometimes we come across some angry staff in the hospital, and they kind of talk to us maybe unprofessionally in front of those patients. Well, one of the things that you hear a lot of is, why'd you bring that patient here? Well, one of my favorite comments is, because this is a great place and they're going to receive some great care. And then after that, I like to take the nurse aside to say, that probably wasn't the best time to bring that up in front of the patient. But remember, we're that patient's advocate, and we need to ensure that they're going to get that good care, and we kind of stand up for them as we need to. Well, one of the things as we give our patient report is we want to be able to give a nice, brief, concise report. They're going to have our patient care record. A lot of times they may not even listen to what you're having to say, but you want to be able to be accurate, brief, and as clear as possible as to what you came across, what you did during transport, and if there were any changes. Of course, patient history that's pertinent, as well as any allergies to medications. Again, a very important component. After you've given your verbal report, go ahead and close with the patient. Say goodbye to them. You've just done a good job of establishing a rapport and building confidence. So say goodbye to them. Hope that they feel better. And of course, get those necessary signatures from the patient as well as the nurse. You know, when we think about the patient handoff is very important to concluding our call. So we want to make sure that we give a good, concise, and brief report to the nurse. We want to make sure that we get our signatures, leave a report at the hospital at the time of service, as well as ensure we say goodbye to that patient. I'm Chris Saballero. Thanks for joining us.